Okay, let's get started. So my name is Haley Minter. I am our marketing and demand gen lead here at Impilo, and I run all of our webinars. Like I mentioned, super excited to have you all today. But a little bit about Impilo and what we do. We are bringing healthcare into the home through remote wearables. So our plug and play platform enables the use of these devices, supplies and sensors by providing logistics, tech-enabled support, as well as the API infrastructure to enhance your virtual care offerings. So not only are we simplifying your operations, we're also offering virtual care program support, acting as your digital health concierge. As always, we're super excited to chat, whether that be best practices or a little bit more about our business. And if you're interested in learning more, always feel free to email sales@impilo.health. So today, as I mentioned, we have Danny as our speaker. She is the head of customer support here at Impilo. She was formerly the director of clinical operations at Alertive. She has her master's degree in logistics operations from Arizona State University, and her expertise lies mainly, but not only, in customer support activation, supply chain, and logistics, as well as operations. So Danny, thank you so much for joining today. If you'd like to say a little piece introducing yourself further, feel free.
Of course. Thank you so much, Haley, for having me here today to talk on this very important process for the RPM programs. I'd like to start just giving everyone a little bit of an insight into my role. I wear many hats, but my role specifically is to understand our customers' workflows to build the right patient journey for the program that they're being enrolled into, right? So I go in and I have these discovery sessions to be able to understand what is it that, or where is it that we can plug our team to provide the most value to our customers. I have, as you explained, I was the director of clinical operations for Alertive. Alertive was an RPM program. So I do understand how challenging integrating the right process for our patients can be, some of the difficulties around consent, adherence, and I think that this has given me like a very well-rounded understanding of how we can dive into the best practices that we're going to discuss today.
Fantastic. Thank you so much, Danny. Now to jump into our content for today. So just a little bit of background. Obviously, we know patient consent calls are crucial in the process of activating your virtual care program. Really having the patient from day one being engaged and excited about the program is a top priority, and Danny and her team here at Impilo do a fantastic job at facilitating that and maintaining the activation throughout the program. So today I want to talk a little bit about the importance of these calls. Like I just mentioned, they're crucial. So Danny, if you can give some context on the strategies for obtaining patient consent from the provider side and how we relay them to those calls at Impilo, that would be fantastic.
Absolutely. So to set a little bit of context, before you enroll a patient in RPM program, it is really mandatory for us to get consent to get that patient enrolled in the program and for all of the billing that will come subsequently. So the process is really simple whenever you have the tools and the metrics and the process in place, but it can feel a little bit challenging at first because of the time constraints and administrative burden that is being provided at the provider's level in the clinics, or even like at the customer site, even when they're not a provider, right? So specifically talking about this consent program, the goal is to get the patient to say yes to enrolling into the program, to make sure that we capture that consent, that we capture anything regarding patient preference in terms of contacting them. Do they prefer us to call, like to reach out to them via call? Do they prefer us to send them an SMS? Do we have permissions to leave voicemails? Those kind of things is what we are trying to capture at that call. And we're trying to leave the patient with a value proposition, right? What is the value proposition of the program that we're trying to enroll them in? Why is this important? And just planting that seed, so that even though if they don't enroll at that point in time, if they have other things that they need to consider, they have that seed and they can discuss it with their provider later on, or they can say like, I think I want to think about this. Can you give me a call back in a few moments or in a few weeks where I have a little bit more clarity on this?
Great. Danny, you mentioned that sometimes in these calls, patients don't automatically enroll and they might have some pain points that need to be addressed. Can you elaborate on some common challenges that providers may face or that we may face in these patient consent calls and how that they can be addressed?
Right. So the first challenge that we often see when we are talking to our customers is everything that comes with like that time constraint and administrative burden that I was referring to a little bit ago. I think particularly in the office, the work that is dedicated there is for patient care and to improving the outcomes of that patient during that visit. So any additional administrative work, any additional devices that need to be provided to the patient at that time, any questions, they could be left open just because, again, the burden is very heavy for the providers to be able to carry. So that is the first constraint that a lot of our customers find today. But in addition to this, the other constraint is, okay, like what happens if the patient says no? Should I just kind of throw the towel and just give up and not contact this patient anymore? So that is a question that we get answered, like we get asked a lot. And the answer I always give is like, not necessarily, right? When you get that data back and you analyze it and you see what kind of information the patients are giving you, you're able to classify them in red, do not contact again. And usually patients are going to be very vocal about this. They're going to tell you, please don't call me again. Or yellow, like, oh, I'm not really sure, I'm on the fence. And then you start grouping them and you start devising new strategies for that. So I think is how do you re-engage the patient when they've told you no? And, how do you track and manage that data to strategize further? And then how do you manage your time appropriately so that you can have a dedicated team just supporting this function?
Great. So you touched a little bit, once we get them on the phone and we get them to activate, let's jump into best practices for these calls. What would you say are some best practices for effectively communicating the value of RPM programs during these consent calls? What have you found in your experience that really has a patient that might be on the fence convert into really wanting to be activated and engaged in the program?
Yes, so Haley, the main point here is to understand that this consent process needs to be tied to the work that is happening in the clinic with the provider. So the relationship between the provider and the patient is the most strong. It's been developed, there's a sense of trust, and the patients will, most of the times, if their doctors say, please, I want you to enroll in this, or I want you to do this, they're going to follow, right? We want to make sure that that relationship has been established. We want to make sure that the patients understand that this is the directive from their doctors, that we want them to be enrolled so that their doctors can manage their outcomes a little bit better. And once we get them on the phone, our agent is able to speak with the patients and they will refer the conversation that they had with the provider. They will refer the pamphlet that was received via mail or by email, depending on the strategy that was used. And the value proposition is to improve the clinical outcomes for the patients and provide them with self-efficacy. And when I talk about self-efficacy, it's like, how do we help our patients to advocate for themselves? How do we teach them the strategies of saying, hey, with this program, you're going to be able to see your readings, you're going to see progress, you're going to see if you're doing better, if you need to go and see your doctor, if you're seeing a different doctor, you can take them readings with you. So trying to explain this to them, I think, is the most important. But once your feet is inside of the conversation, you're able to talk more into what are your objectives, right? Like if a person's interested and they open the door to like a more honest conversation, you can ask them, why are you interested in this program? What are you trying to accomplish? And they can tell you, well, I'm really worried about my health, right? And when they start telling you things, you can really start catering that education to that specific area that of concern. And that is a very quick buy-in for the patient to enroll in the program.
Awesome. Thank you so much, Danny. From what you've been saying thus far, really emphasizing on the relationship and rapport building with patients is of utmost priority, correct?
Yes, absolutely.
Awesome. So obviously, once you build that rapport and all of that, a patient might love you and be willing to engage in the program. But let's say data and privacy concern is something on top of mind. How would you go on approaching a comment from a patient in that regard?
Right. So again, this starts at the provider level, but let's say that, let's take an example where the provider didn't get a chance to speak to this patient about us prior or didn't get to explain that this process was going to take place. I think addressing the patient and making sure that they understand that the data is treated in the same way that any other of their data is being treated, compliance through the HIPAA, right? Making sure that we have that in place and explaining it in plain words and saying, we will never release any data from this conversation that is not meant for you. Obviously, we go, before we even engage in the call, we have a patient verification protocol where we make sure that we're speaking to the right person. If we're not able to verify the patient, then we will never say, for example, if you're calling someone for blood pressure, you will not be saying, hey, I want to enroll you in blood pressure program, because you want to make sure that you're speaking to the right person before you even go that route. So I think just, again, planting the seed throughout the call and making sure that they feel comfortable with you, and then addressing those concerns of how our data is going to be managed, asking questions about how they want us to approach them in the future. That is going to establish the trust of the patient. And again, obviously, everything needs to be compliant with HIPAA, and all of that needs to be taken into account so that you can explain it to the patient, but also so you have that documentation for compliance purposes.
Great, thank you for that, Danny. So obviously, once we have the patient on the phone, there's going to be some pain points that come up, and we want to talk about solutions and strategies to navigate those, so that anyone in a customer support role will know what to do when they're approaching these calls. So how can providers overcome the time constraint and administrative burdens that come with patient consent calls? Have you seen anything like our services that are really eliminating that burden?
Yeah, absolutely. I think the biggest value that our customers get whenever they sign up with this service is that we are just essentially taking that burden off of them, because we have a dedicated team that handles the consent, enrollment, and device setup. And this is important. I know we're just talking about the consent piece, but think of how you're establishing relationships with this patients, and they really love speaking to me, right? If I'm on the phone with them, if I'm the one letting them know that the delivery of the package is on its way, and then if I'm the person educating them on how to take readings, and if I'm the person educating them, and I know why they signed up, I know that I did some objection handling, I know that they're concerned about their health, and I can use that throughout the program to keep them motivated. My main goal is to, once I have them, because it's really hard to get them, I want them to see the value and I want them to stay, right? So our team of dedicated agents is able to execute on that beautifully, right? We build relationships. And then again, that just by us going in, doing all the tracking, the monitoring, the data collection, all of that gets sucked into our piece of the work that we're doing. And it leaves the clinical team just to focus on, okay, here's the data. What do you need to do with that data? Do you need to increase the dosage? Do you need to decrease it? Do you need them to go and see another specialist? What exactly do you need to do with that data? And you don't have to worry about, did we get the right code in place? Did we get the consent? Did we disposition the patient the right way? Should I talk to them later? Should I talk to them earlier? Do they prefer SMS? All of those considerations that our team will have full visibility on when they are engaging with the patients.
Great, thank you, Danny. That is super helpful. So when we're on these calls, as the majority of people in the RPM space know, our patient population lies primarily within elderly individuals over the age of 65. So during these calls, they may not have context of different data collection methods or various ways that the program works. So can you explain some effective strategies for collecting the data that you need within these calls to ensure a successful start to their program?
Right. So the specific data and the demographics come directly from the provider or the customer in this case. So we want to make sure that they give us all of the data to be able to push a successful enrollment, right? We want to just confirm the data so that the patient feels like, hey, I'm just confirming this, as opposed to just always pulling data from you. So saying something like, Mr. Smith, I have, 123 Tessville Lane in Tessville, Arizona. Is that a current address for you? And we just kind of use that to be able to make sure we have the correct contact information. Now, where data collection starts to get a little bit more complex is when we are getting data that will help us with adherence and will help us with compliance. So what was the disposition of the call? Was there any specific notations that we discussed with the patient that are going to be important for the provider to know in their next visit, or for our team to know when we're doing consent calls, right? All of that is the data collection that we want to, again, express to the patient that we want to save for future engagements, and obviously let them know that this is something that is going to be addressed in a safe and secure manner. Now, a lot of people ask me, but like, why do you need so much data? Why is that important in this type of process? And the answer is because not every provider is going to work the same way, because the patient demographics might be different, because the ages might be different. And like you were mentioning, we work with elderly populations, but we also work with populations that are elderly and very tech savvy, right? So we need to learn that. We need to adjust our processes and our strategies and be able to adapt as quickly as possible. And that's only done when you're able to get data in front of you and you're able to strategize and see, hey, these are my green patients, these are my yellow patients, these are my red patients. Why am I getting lots of red? What is going on? Is there anything I could be doing from a tool perspective? Could I be changing the brand on my phone number to display something that they're more familiar with? Should I be encouraging, maybe sending some collateral material ahead of time? So that data is going to be driving that decision making behind that.
Great, thank you, Danny. From all the context you've provided thus far, you're proving to the point that you are obviously an industry expert, as I know, and now our audience members are learning as well. But let's just say that we're dealing with someone new to the space and they're just launching their support for the program. How can someone that's engaging in these calls that doesn't have as much experience as you approach this? Is there a certain flow that they should follow, best practices in that regard?
Yes, absolutely. I think the most important thing, if you're new to the space, is there needs to be some processes, and my mind is very much aligned with this is the process, this is the SOP. But at the end of the day, you just have to be human, right? Like I think all the time, like if I were receiving this call, how would I want it to be approached? Obviously, I would want to feel like my data is safe and secure, but I would also want to understand that maybe I don't have a relationship yet with the person on the other line. So it's okay if the person is not super excited to hear me the first time around, and just listening, asking them very simple things like, how are you doing today? How's your day been? Just to get and build that rapport and make that patient feel heard. And then instead of just trying to push something on them and saying like, hey, I think you need this program is awesome for you, is like, okay, are you familiar with this program? Have you ever been informed of a similar program before? Have you ever taken your blood pressure at home before? Things like that will help you understand where the patient is at, and then come and just strategize on, okay, what is the best approach for this patient, right? And that is just, if you're talking to me, if you're talking to another person, how would you have that human to human interaction to make the other person feel safe and secure in the information that you're providing? That would be like the best practice that I can give you, other than make sure you have a process, make sure you have your data, and make sure you understand, you are able to capture all of those objections that are coming in day in and day out. And that sometimes you're like, oh, I didn't have this objection on my list. How do I approach this? You got to make sure you're having those processes, but the human touch is always going to be paramount.
Great. Thank you, Danny.
Of course.
So like we spoke to this entire call, you're head of support and you're dealing with these calls and these objections day in and day out. So Impilo is playing a role in facilitating these calls. How would you say that Impilo plays a role in the end-to-end support in patient calls? Can you explain that process of how we come in and we play a crucial role in this process?
Right. So at the beginning of the call, I told you that my role was to make sure that I understood the patient journey, right? So every provider has a different patient journey. We have different providers that might be reaching out to patients to confirm appointments. And all of these touch points are important. And the reason why I always ask this is because I want to make sure that our agents are able to mirror the brand that they're representing. We want the patients to feel like all around this process, it's one unity. There's one entity behind that is trying to push one agenda forward, that it is their care, right? We want to make sure that they feel that. And with that in mind, we draw out a plan, right, where we can inject some additional touch points to provide that white glove service. So where we start is consent, and we evaluate again, like, how could we make this person trust the process and make sure that they get into this program with some buy-in, knowing that this is the best for their health. Then after we've done that, we talk to the patient to help them set up their devices, right? A lot of these patients have never used devices at home. They might have questions about how to use them, the frequency that they need to be using them with. And while we're getting this information from the provider, we are the ones transmitting it because we are in charge of that first call to make sure everything is working well with that patient. During that call, we go into something I like to call like a habit boot camp for the patient if they feel like this is going to be a challenge for them. Because again, you have noted in your previous conversations with the patient what might be their challenges, their fears, why they wouldn't be inclined to sign up, and why they ended up signing up at the end, right? So being able to say like, okay, I know that you, let's say you had concerns because you didn't have time to take readings. So I want to make sure that within this first 21 days, let's go ahead and set up reminders for you. When will you be taking readings? Will it be, 10 a.m. to 12? Okay, beautiful. Is it okay if I reach out to you? And then we make it fun. We send fun text messages to remind the patients and to catch up with them. And then that is going to be our welcome and adherence process. So this is all like at the beginning of the program. Then we move into more like the maintenance mode. So what happens if the patient is not taking readings as expected after you've already done all this work with them? Can you re-engage? Have you set the right tools to be able to understand what are the preferred methods of communication for this patient if this occurred, right? Then did the patient have trouble with their devices? Can we help them troubleshoot? Can we liaise with their manufacturer because the data is not coming through correctly? Can we support them with that replacement because ultimately we were not able to find specifically what was going on with the devices and there's no errors coming up for the patient? That is part of their maintenance, right? And then at the end, throughout their disenrollment period, whenever a provider deems that this patient should not be in the program anymore, we go in and dive a little deeper. It's like, why do you want to disenroll? I know that you signed up for this. Have your goals been met? Is there anything else that you're trying to accomplish? And if the patient says, ultimately, I want to sign out of the program, it has been great, or I've accomplished my goals, then at that point, we support with the reverse logistics process to make sure that the customers get their devices back, right? And that will be like the whole patient journey. On top of all of this, I like to just visualize it as, you have your patient journey and then you have your logistics support. Because across all of this, things could happen. What if, we tried to deliver the device and we had the wrong address or there was a failure in the delivery? That's where our team also, the same person who's been going through all of this, is going to make sure to address this with the patient and make sure that they get their device as quickly as possible so they can start with their program. And all of this will be reported in a very easy way for the provider to know what has happened that month. Have we engaged the patient? Have we talked to them? Is there a concern that they're having? All of this is documented and lives within one place so that it is very clear what has happened with that patient throughout that month or throughout the period that you're interested in looking for.
Awesome. That really did a great job at explaining a little bit about our customer support process here at Impilo. You mentioned at the end there that the provider is able to see it all on one platform. Obviously, I know what you're referencing to, but can you speak a little bit to how support works in our platform to relay that data to providers?
Of course. So imagine that you have a patient profile and you have different tabs where you can see different things. So you can see your data, you can see your orders, you can see any alerts, right? You can see any clinical notes, and you can see any support engagement that we've had. So you can see it in tickets, you can see the dispositions for each of the calls that we've had, the dates when they've happened, any context around those calls, any escalations if we, for example, had an issue with a patient that was out of our scope because it was a clinical question, then we send it back to the provider. You'll see all of that documentation, like I said, in one place. You can see it in chronological order to understand again and get that context of what's happening with a patient, not only from a support standpoint, but all around like the holistic approach for that specific patient.
Great. I think it's just fantastic that we're able to have all this data live in one place. Obviously, we know providers are very busy. They have everything going on in many different directions. Yeah. So to have it live singly in one place kind of just keeps everyone on the care team, both from provider end and from partner end, on the same page. So we touched about being able to view that data. How is Impilo using this data to consult providers on how to best optimize their virtual care programs?
That's a great question, and I think that is the most important service that we offer is a consultancy and a partnership, right? Because again, we are dealing with these patients directly. We are seeing it firsthand. We are seeing the reports that we're getting. So, for example, simply saying to the provider, I'm seeing that you have this specific situation with your patients. Maybe we should change the insert because we're not getting a high engagement on that consent, right? So there was no like bite to that first engagement with the customer or the patient. And those are the type of things we can monitor. Or perhaps, I know that initially you wanted just to focus on calls. We do also do SMS, and we do also do video calls and emails. Should we try something different? Should we try a different approach? And they're very data-driven decisions. They are also help us, guide us in like what's happening in the industry, what changes we're seeing. Like the elderly population a couple of years back were mostly having flip phones, but today a lot of them have smartphones. A lot of them are, having to become a little bit more self-efficient with technology, and that is constantly changing. So if we are able to see that from the beginning, we might be able to unlock other things for them, right? What is the right device for your population? Do you want to do cellular? Do you want to do Bluetooth? Here's what we've seen when we've talked to the patients, a lot of tech savviness or not a lot of tech savviness, so you should stick to this one, right? So I think it's just a combination of having like a very holistic approach of what's happening with your patient and being able to consult on what your priorities, your goals are, and how we can best assess them and support you on those.
Great. Thank you, Danny. Loved how you mentioned the holistic approach. Like I mentioned before, having everything in one place is so helpful, and just having everyone on the same page really emphasizes on patient care and making sure that they have the best experience, so that if they do become unengaged, we are able to have that report to get them back very quickly, have them take their readings and log it, so that everyone in the program is happy at the end of the day. But you provided some great context thus far, so I want to open it up to the audience for some questions in a Q&A session. So I will give everyone a minute or two to ask your questions. Feel free to ask anything that has popped into your mind throughout the webinar, or questions related around support or Danny's role here at Impilo. But we'll get started at about 1:05 with our questions. We actually have a few questions coming in now, so we can kick it off while these continue to pour in. But we'll start it off with this one. This attendee asks, what advice do you have for a company that is first starting out with patient consent calls?
I think the first thing that I would recommend is to have a way to be able to document the outcome of the calls that you're having, right? So you should be very structured and have some dispositions in mind to be able to quickly assess the efficacy of the calls that you're placing, right? I would also make sure that you include times when you're calling to see if there's a different success in the mornings and the afternoons, and be able to tackle again, is it like when you first start making calls, it's like, okay, is the problem that I'm not able to convert once I'm on the phone, or is the problem that I'm not being able to get them on the phone, right? So those are the two things that I would say, is making sure that you definitely need to have a reporting mechanism to be able to track this.
Awesome. Thank you, Danny. That's very helpful. So the next question that is being asked is, how do you combat non-compliant patients? This kind of ties into another question which we have, is how do we re-engage patients who have initially declined consent?
Okay, so I'm going to take a non-compliant patient as someone who doesn't want to enroll in the program first, and then I'll talk about a non-compliance event later in, downstream. So for a non-compliant patient in the first situation, is understanding why, right? It's trying to get them to talk about why they do not want to be in this program. Is it because they have time constraints, cost constraints? They generally don't think that this program is efficient for them. If so, why, right? And just having that conversation, not trying to sell them anything, right? Being able to know when to keep pushing and when to back out, but for your own understanding, what is it that the patient feels like we're not addressing in this program that they would like. And many times what I like to say, and this is like a I call them gold nuggets that we give to our agents, is like, this is what's happening to you right now. This is how you feel. This is how other people felt. And then this is what we've seen, right? So we've taken a perception from a patient. We've been able to identify other people and told them, you're not alone. A lot of people who started in this program felt the same way that you did. And this is what we found for these people, right? So having all of those, having all of those things in one place when you're doing objection handling is going to be helpful to turn around people or to just simply establish a position of trust. So in the future, if again, we planted the seed, we re-engage with them, then they'll be all covered. And something very similar happens with non-compliant patients once they've signed up and they just stop taking readings. We want to get them on the phone and understand, why did you stop taking readings? Is it because you were on vacation? Beautiful. Don't worry. We want this program to adhere to your lifestyle, not the other way around, right? So how can we best support you with whatever is happening? Was it a tech support issue? Again, is it like you feel like you don't have time for this? Does this feel like perhaps your doctor's not getting the data that you need? You're not getting the results that you were hoping for, and just again do that fact finding so that you can recommend a solution for that patient.
Great, that is very helpful. It seems as if we have one more question today. So this attendee asks, what strategies do you use to ensure patients are responsive in their program?
So there's many things that you have to do to be able to get the patients responsive. I think the first thing you need to do is you need to make sure your phone is registered with the CNAM. That means that the brand that is associated with that phone number is going to display on the patient's phone number. There's a couple of other hacks that you can do so that your phone number pulls out of any registries from spam. So you got to make sure that your number is registered. You have to make sure that the patient, if possible, is acquainted with that phone number, and that can be done through previous communication done with the patient. You can also do a strategy of multiple different types of communication. So you call the patient, they didn't answer, you send them an SMS, being able to identify who you are and why you're calling. Again, SMS only if you are allowed to do SMS for that patient, if it's part of their patient preferences. And then you can continue to build that information for the patient to know who is going to be calling. Once you have done a couple of voicemails or a couple of text messages, the patient's responsive rate is going to go up if they're interested in the program. And that comes back to scripting and how we analyze the SMS and voicemails that we're leaving. They need to be capturing, they need to be engaging, and they have to display trust. And like, we're not coming in and just kind of soliciting any type of information from you. We're trying to get you on something that your doctor provided us to share with you.
Great. Thank you, Danny. It seems as if that's our last of our Q&A questions for today. Before we wrap up the webinar, is there any final thoughts or best practices that you would like to share with the group?
No, I think, first of all, this is a topic that is very interesting to me because I've seen it all when it comes to consent calls. And I think ultimately what I always tell my team is just to remain human, right? There's obviously a process that needs to go into consideration, but think again, if you are receiving this call, what would you like to get from this call? What kind of information are you trying to get from this? What kind of treatment are you trying to get from this, right? We recently have a customer or a patient that asked to speak to me because they were so happy with the engagement that they had with one of our agents, because she was able to laugh, she was able, to share her hobbies, she was able to even not for this particular patient, but I had another patient who, I was able to connect regarding her dog. Her dog was there while we were conducting a call, and the dog was a little bit, fuzzy, and we were able to connect on that dog. And now I know her dog's name, and we can continue to engage. And once you build that relationship, having these conversations is going to be inherently more easy because you don't have to figure out, how do I get this person to trust me? Because you've already built that relationship.
Great. Awesome, Danny. Well, thank you so much for sharing your knowledge on patient consent calls and just support in general.
Of course.
Obviously, you are so knowledgeable, and I'm sure that everyone in attendance gained something out of this call. I know for a fact that I did. So very helpful. And we thank you for taking time out of your day to speak with us
Of
today.
course.
But thank
Of
you
course.
to all the attendees who joined today. As always, the webinar will be available for you about tomorrow or Friday for your review. We'll send out an email with everything summarized so that you could send to colleagues, as well as a link to the recording. If you want to share to anyone in your network that may find this valuable, feel free. But thank you for joining us today. As always, feel free to email us if you want to learn more information or stay connected at sales@impilo.health. You can find us on the web at www.impilo.health. Notice I said there's no .com at the end of that. And if you want to send us mail by any chance, our address is there for you. But thank you so much for joining, and I hope everyone enjoys the rest of their Wednesday. Thank you again, Danny, and have a great day.
Thank you all. Have a great day.